So these will be big, but they'll fit. So any questions so far? Oh, much better. Look how big they are. See, they're huge. Okay. Okay, so now I'm sterile. So now pretty much I'm going to start working my way back this way. Okay? So be very careful. That's unsterile. So I have to literally pick it up like this. See, that's just a problem. Okay. Okay. If you don't pull the suction back when you get it in there, it's almost impossible. So pull back on it a little bit. Okay. So now I'm not going to cross my sterile field. I'm going to put it in there and drop some water. You know, we're trying not to hit the sides, but it's impossible. So, okay. So what would I do next, y'all? Angiocath, right? I'm going to have to adjust these gloves a little bit. Just too big. Okay, so now I'm being very careful picking this up and putting it on there. And then what am I going to do? Debrief the wound, right? So I still can see my sterile field. You go from top to bottom, and you're applying the pressure. Okay, now I'm done with this. Can my, I'm dropping it. Can my nurse aide, in real life you'd ask the patient to roll over if they could, but can my nurse aide pull that out and get rid of it? You can just put, you'll pull out the whole wound. Or you can roll the mannequin.
Like that?
Yeah, and then it fits back in there.
You gonna be the nurse aide in the...
Sure, yeah, I will. And then do you have the trash, or we can pretend like just pretend like there's a chucks and you just put it on the chucks, like the patient rolled over and it came out.
Just
yeah, so you'll just kind of
really pour it.
yeah, it's just water. Okay, now you'll stick it back in. Sorry. Thank you, nurse aide. Okay, so now next I'm going to clean the sides. So I'm going to take one of these gauze. I'm going to crumple it up. If there's any excess water, you could squeeze. Okay. Now, very careful, and this is where my gloves are a mess. You just touch, and I can still see my sterile field. You just, I don't want my fingertips touching because they're sterile, right? Okay. One. Then I'm going to do the other side. And because I have my supplies positioned this way, I'm not crossing over anything, right? So it's very critical how you set up your supplies. Okay, same thing. Okay, next I'm going to use one of these to check for sinus tracts or tunneling. Okay, so I come in here and I'm just seeing if there's any holes basically. Okay, so no sinus tract, no tunneling noted. Okay, and next I'm going to measure. So I'm going to grab another one. It's hard with long gloves. Okay, so there's my little ruler. So first you measure the length. So you get it as close as you can without touching the skin. If my gloves fit right, I could get really closer, but I'd say it's about right there. About 12 centimeters or centimeters. And then you're gonna reach up and you measure the widest part of the wound, about 2.5, and then lastly the deepest part. And you go like, and I can still see my sterile field without touching the skin, which is very hard with long gloves, about right there. Let's say about 2.5 or 2. Okay, so you'd have to remember those measurements. All right, so now I'm ready to pack. So what you do, you kind of separate the gauze. Anybody else's allergies bothering them? It's horrible. Okay, there it goes. Okay, and then not tightly, but you want to kind of go like that, okay? And I always make sure the very end, because when I start packing, is somewhat squished together, okay? Now I'm coming in, I'm going to use this, and I'm going to start packing. I can still see my sterile field. trying not to touch the skin at all, right?
Crossing it.
Uh-huh.
If there was drainage on that wound
Uh-huh.
while you're preparing the 4x4,
Uh-huh.
would you just let it drain out or flush it, like irrigate it?
Hopefully the debriding, hopefully when you use that, it loosens some of it. Does that make sense? And hopefully when you pulled this out, it came with it. Does that make sense? So in theory, we hopefully have taken care of most of it. Does that make sense? But there might still be some. Okay, so sometimes if you can't, you see how that's fat right there? So what I can do is just use one and go ahead and fill in half. You want to make sure as much is covered as possible. And then I'll use another one to pack that. I'm going to try to go with this far on the edges as you can. Okay, I'm done with this. One more, right? I'm making sure I'm not crossing over. Oh, this one came quite easy. And you don't want it like super tight, but you have to have it somewhere in order to.
So like if it's dripping, you just let it drip on the floor?
Yeah, you can rinse it out. I mean, you can wring it out a little bit. You're sterile and I'm not over anything. So there you go. And then this one, I'm going to try to start right there. And then I get that little piece. Does that make sense?
Mm-hmm.
It's easier to start getting it instead of coming back across. Start out getting it. And I'm trying not to touch the skin. There's a difference in me being very careful on some of it touching and this. You understand? So, I mean, is some of it? Yeah, but I'm very making it very minimal, the best I can. Okay. So now I'm going to do my 4x4s. Bigger, and then my ABD or combine. Okay, and at this point I don't have to be sterile, and I'm going to tape it, and then I'm going to have a pin, and I'm going to put the date and the time and my initials. Okay, and what I could do at this point, it's hard to tape with those long gloves. Any questions? Let's see it.